The other thing I wanted to talk about was shift work. Obviously, I work in a hospital. I've done shift work myself. There are a lot of other doctors and a lot of nurses who do shift work, really do night shifts really frequently. Um,
Yes.
so, do you have any tips or advice on how to manage sleep with shift work?
Yeah. First of all, I spell shift work without an F. Shift work is. I have a very strong stance against shift work. Um, if at all possible, we should not be doing shift work. That's against our biology. We evolved, for most of us, we evolved to sleep at night. Only a small minority of us are night owls who thrive being awake at night. So, as much as possible, avoid shift work. However, it's a reality for our profession and for many folks. There actually are shift work sleep recommendations. So it's in the literature, but rarely do organizations even, I've had flight attendants and pilots, even organizations or corporations who deal with thousands of shift workers do not look at these guidelines or recommendations. So there are recommendations to help shift workers sleep. Okay, so the problem with shift work is, of course, you're awake at night when you're supposed to be asleep. And then you go home in the morning. I'm just talking about classic shift work. You go home in the morning and you want to sleep, but your natural body rhythm wants you to be alert because it's morning. So you're at a disadvantage of sleeping. So some basic recommendations would be as soon as you finish your shift, before you go home or before you leave the hospital, make sure you wear sunglasses. You don't want to be exposed to bright light because bright light in the morning tells your brain, hey, wake up. It will stimulate you. So put on sunglasses and then just before you go to sleep, preferably 30 minutes, an hour before sleeping, if you can have melatonin. So melatonin in New Zealand is a prescribed medication, but in most countries, it's a natural supplement. So in New Zealand, if you're having problems sleeping after a shift, ask your GP for melatonin. Melatonin will increase your chances of falling asleep in the morning. It will not be the same as your natural sleep at night. And once in a while, you might need to use sleep medications. There are all sorts. It's another big discussion. So expect that your sleep during the day will not be great. And one technique as well, not related to sleep, but related to alertness when we're doing shifts. Again, this is in the literature. Is when you're doing night shifts, it can be very helpful to have to use light boxes. Light boxes, or now we actually now have visors that emit light. Pulses of that, 20 minutes here and there during your shift can keep you quite alert, in addition to caffeine. And then during when you go off shift, that's when you shift from blasting yourself with light to avoiding light by wearing sunglasses. So learning a little bit of basics of the circadian rhythm and how to work with it can be very helpful in shift work.